82-year-old woman is admitted following a fall. She was on the floor for 3 days. She is delirious, cachectic, and unkempt. In the picture, we can see a depiction of lesions on her feet. Which is the most likely diagnosis? A. Arterial ulcer. B. Dry gangrene. C. Neuropathic ulcer. D. Pressure ulcer. Or E. Venous ulcer. I just want you to pause the video here, take about 30 seconds to think about the correct answer. And the correct answer is D. Pressure ulcer. And we'll go through why in the following slides. Pressure ulcers or pressure sores describe localized injuries to the skin and underlying tissue caused by prolonged pressure, shear, or friction. They most commonly occur over bony prominences such as the sacrum, heels, or hips, which are often affected by having pressure applied to them for a long time, particularly in bedridden or immobile patients. Risk factors include being bedridden or immobile, poor nutritional status, immunosuppression or poor wound healing such as diabetes, inadequate social support, and a lack of pressure care. The staging of pressure injuries is included in these images below. The stage 1 pressure injury describes a non-blanchable erythema of the intact skin. Stage 2 describes a partial thickness skin loss where there's exposure of the dermis. Stage 3 describes a full thickness skin loss in which fat is then visible in the ulcer base and granulation tissue is often present. There may be slough or eschar. Stage 4 pressure injury describes a full thickness loss of the skin or tissue with exposed or directly palpable fascia, muscle, tendon, ligament, cartilage, or bones. And further on from that describes an unstageable pressure injury, where there is obscured full thickness skin and tissue loss, where there is so much slough or eschar that the extent of tissue damage cannot be determined. A deep tissue pressure injury is a further type where there is persistent, non-blanchable, deep red, maroon or purple skin discoloration, but the overall skin is intact. Management of pressure sores includes relevant investigations, including a clinical examination to assess the wound stage, size, depth, and presence of any associated infection. Wound swabs and cultures should be performed, particularly in the concern for superimposed infection. Full blood count, CRP, ESR, and culture should be performed to assess for any associated anemia, infection, inflammation, or systemic sepsis. And X-rays or MRIs of the affected body part can be performed to evaluate for any risk of deep infections such as osteomyelitis, particularly in cases such as pressure sores of the heels. Management of pressure sores includes pressure relief and prevention, with regular repositioning at least every 2 hours in bedridden patients, pressure relieving mattresses and cushions, adequate skincare and good moisture control. Management of pressure wounds includes for stage 1 and 2 wounds, keeping the area clean and using protective dressings. And for stage 3 or 4 wounds, debridement is essential to perform, which is either performed operatively or enzymatically with dressings. Moist wound dressings such as hydrocolloids, foam or alginates are typically preferred, and negative pressure wound therapy can be administered, which is vacuum-assisted wound closure, which can help to debride any excess fluid or infection out of the wound and aid closure. Infection control with antibiotics or antiseptic dressings is often important in the case of superimposed infections, and nutritional support is essential to optimize wound healing with high-protein diets, adequate hydration, or vitamin supplementation. In severe cases, operative management of pressure injuries should be performed, which includes excision of the pressure sore and a skin graft or flap reconstruction. Complications of pressure sores include infection, which can lead to cellulitis, osteomyelitis, and further develop into systemic sepsis, and this is the most significant complication. Chronic wounds can develop, which can lead to pain, reduced quality of life, fistula formation, and may subsequently lead to amputation in lower limb pressure injuries. Just going back to our stem, we can see features in the stem that suggest a likely pressure injury include a fall and being on the floor for 3 days, which is a long lie, the patient being delirious, cachectic and unkempt, which indicates a risk of inadequate social supports and setup. The lesions on the feet, we can see bilateral symmetrical lesions, which again is a suggestive feature for a pressure injury, over a pressure point, and we can see where there's been full thickness skin loss and necrosis of underlying tissues in keeping with a stage 3 or 4 pressure injury.